This baby girl born with bilateral congenital cataract. We did cataract operation and implanted IOL in both eyes with anterior vitrectomy at her 2 years of age. She lost follow-up because she went abroad and grown up with her family. After 12 years, she returned back with gross refractive errors and anisometropia. Right eye was -16 and left eye was -7 diopter spectacle. It was very difficult to manage such spectacles for her daily work. We planned to implant an presbyopic toric add-on lenses in both eyes. Those were customized for her eyes. The brand is Salcofix and it is made by IO Care India. IOL power calculation required biometry, diffraction, white to white measurement, AC depth, etc. This lens has 4 loop haptic. This is a toric lens and there is toric mark. This is very easy to load and very easy to implant. We just put the lens inside the eye, don't need to put under the iris primarily. We can tuck it under the iris with any manipulator. This is a very helpful lens in case of postoperative refractive surprise. We implanted the second eye 1 week later and no complication happened, no IOP raise happened and vision was 6/9 in both eye independently and N5 without any spectacle. Patients who have monofocal lenses in eyes after cataract surgery and don't like to wear specs can go for this lens implant also. We restore vision.